When we counsel our patients regarding the duration of maintenance bevacizumab, typically I counsel my patients based on GOD 218 and ICON 7. And so really what we're looking at is a year of post treatment maintenance therapy with bevacizumab. There is a study by Ahmet Oza that evaluates should we keep this going for longer. And I think that we don't necessarily have definitive answers from that at this point. What we know is that in this large study that Dr. Oza did, really that patients can be continued for a long period of time with some increase in side effects, but rarely having to discontinue their therapy. So I think time will tell if we should continue therapy for longer than that additional year on maintenance. But I think that at this point, most of us use 1 year of maintenance therapy after. One additional consideration for this patient actually would be the incorporation of olaparib into her treatment regimen for maintenance therapy. So the PAOLA-1 trial evaluated specifically that question in patients with advanced epithelial ovarian cancer, regardless of BRCA mutation. These patients were given olaparib and bevacizumab versus placebo and bevacizumab. Now, we don't know really what a placebo-only arm would have looked like, but we do see an improvement in outcomes with these patients who had olaparib and bevacizumab together compared to bevacizumab alone. So interestingly, this is an option to discuss with patients to consider 2 years of olaparib in addition to bevacizumab for even BRCA negative patients. This is a very exciting time for development of therapy for patients with ovarian cancers. We have so many options at this point and so many that are just continuing to develop. For a long time, we were sort of stuck with just standard chemotherapy. And now, in addition to PARP inhibitors, we have small molecule inhibitors, we have immunotherapy. We have so many different options for treatment. The question is really how to potentially combine those treatments and which patients to use which treatments for at which time. So I think it is an exciting time. We'll figure out how to incorporate molecular testing. We'll figure out how to incorporate the combinations of these therapies as well as novel therapies in the future. It'll be really exciting to see what comes of the IMagyn050 trial. So basically, this is incorporating atezolizumab in combination with paclitaxel, carboplatin, and bevacizumab. So hopefully, we'll be able to have interesting results from this in the very near future. So I think it's an exciting time for patients. Obviously, no one wants to be diagnosed with ovarian cancer, but the options that we have for our patients now are just simply so much better than they used to be. We can really tailor therapy and we can limit morbidity. And we can affect cures in patients where we simply didn't know how to do that in the past. So it's a good time to be a GYN oncologist and a better time to have ovarian cancer.